Hello, my name is Jaslyn and today we'll be performing a head-to-toe physical assessment for Dr. Buford, fall 2025. Today is November 21st, Friday, 2025. And I will just start by scanning the room. All right, so to get started, we have already examined the head, the face, the neck, the anterior and posterior abdomen. And we have done that in privacy for the patient. And so there were no lesions. The temperature is appropriate for ethnicity, appropriate in color. The temperature is warm. There were no nevi present, no lesions. The turgor is good, and there was no edema. So then we will move on and just inspect the head and scalp. So I'm palpating the head and scalp. All right, there is no tenderness. There are no manifestations, no nodules present. So then the color is evenly distributed for the patient's color. It's a natural black color. So no issues there. We will move on and inspect the temporal arteries. All right, temporal arteries are a +2 and equal bilaterally. So then I will move on and assess and palpate the lymph nodes. So starting with the preauricular lymph nodes, the postauricular lymph nodes, the occipital lymph nodes, and tonsillar lymph node, as well as the submandibular lymph node, submental, the anterior cervical, posterior cervical, and the supraclavicular. Okay? So moving ahead, then I would move on to the ear exam. So I'm inspecting the patient's ears. So the ears are both symmetrical and equal to the midline to the patient's face. I will then go ahead and get my ophthalmoscope and listen to each ear, or take a look in each ear, sorry. Turn it on. All right, so I've inspected both the pinna and the targus, and the auditory canal is clear. The temporal membranes are a pearly gray. So then I will move ahead and do cranial nerve number 5, which is trigeminal. So for the trigeminal nerve, cranial nerve number 5, I will go ahead and inspect cranial nerve number 5, the motor portion, by asking the patient to clench her jaw. All right, great. So the motor portion is intact. And then go ahead and move on to the sensory portion. I will ask the patient to close her eyes and just let me know where you feel each touch.
Forehead, right cheek, left cheek, chin, nose.
All right, correct. So cranial nerve number 5, sensory portion is intact. So then I will go ahead and just finish performing my ear exam using my tuning fork. But we will start with a series of 3 tests. We will start with the whisper test and then move ahead to the Weber exam And then last we would do the Renee's test. So for the first exam, I will need you to cover your left ear. I'm going to whisper 2 words in your right ear, and you just repeat those 2 words back to me.
1, 2.
Then cover your left ear.
3, 4.
All right, great. So hearing is intact. And then the next test is the Weber test using my tuning fork. I will activate it. All right, could you hear the sound equally on both sides?
Yes.
Okay, so lateralization is not present. So then we will do the last test, which is the Renee's exam. So with this one, I will place the tuning fork on the mastoid bone and then in another location, and you just let me know which sound is heard the loudest.
2. 2.
Okay, great. So air conduction is greater than bone conduction. So then we will move ahead, and we would move ahead to the next exam, and we would test cranial nerve number 3. So cranial nerve number 3 is the oculomotor, and starting to test the oculomotor nerve, I would use my pen light, and I just want you to follow my pen light with your eyes only. Okay, so cranial nerve number 3, oculomotor is intact. So then I would move ahead, and I need to also inspect the patient's eyebrows. All right, and I will also inspect your sclera and conjunctiva. All right, so the sclera is white and the conjunctiva is pink. The hair is evenly distributed across the face, and there's no facial hair noted otherwise besides the eyebrows on this patient. So then we would continue testing the eyes, and we would next move ahead and use the Snellen chart to test cranial nerve number 2, which is the optic nerve. So could I get you to cover your left eye? Could you read the last line for me?
LTFPH.
All right, and then cover your right eye, and then read the last line for me.
LTFPH.
All right, good job. So visual acuity is intact, vision is intact, and it is 20/20. So then I would go ahead and test cranial nerve number 3. Once again, using my pen light for pupillary response. So just look straight ahead. All right, so cranial nerve number 3, oculomotor, is intact. The pupils were responsive and equal. Both were responsive and equal to light. So then we would test cranial nerve number 3, 4, and 6. So that is the oculomotor nerve for cranial nerve number 3. Cranial nerve number 4 is the trochlear nerve, and cranial nerve number 6 is the abducens. So in order to test these nerves, I would just take my pen light and test the extra oculomotor movements. So just follow my pen light with your eyes. Okay, great. So cranial nerve 3, 4, and 6 are intact. So the last thing I would do is test your peripheral vision. Cover your left eye for me. How many fingers am I holding up?
1, 3, 2, 1.
All right, cover your right eye. So how many fingers am I holding up?
1, 2, 3, 1.
All right, great. So peripheral vision is intact and no signs of conversion. So next we will move ahead to the cranial nerve number 1, which is olfactory. So to begin the nose assessment, we would start by first inspecting the patient's nose. So the nose is midline, and then I would test for patency. So could you blow out for me? Okay, so the nose is patent and midline. So then I would test smell, olfactory, cranial nerve number 1, which is smell. So I will get you to close your eyes for me. And then I'm going to occlude one nostril and have you, what smell is this? Tell me what you smell.
Alcohol pad.
Okay, and then I'll test this side. What do you smell?
Alcohol pad.
Okay, so cranial nerve number 1, olfactory, is intact. So the next test that we will perform, we did not get a chance to test the red light reflex with the eye assessment. So we're gonna go back and test the red light reflex using my ophthalmoscope. Alright, so just look straight ahead for me. Okay, and the red light reflex is normal. So then we would move ahead and inspect the neck, the patient's neck. So the neck is midline and subtle. And then we would go ahead and palpate the trachea. Okay, trachea is midline. I'm going to stand behind here and just move your trachea over to the left. Could you swallow for me? And then move your trachea over to the right. Could you swallow for me? Okay, and then I'm going to palpate your thyroid gland. All right, so then I would palpate your carotid artery. Okay, palpating the carotid artery there, and also auscultate over the carotid artery for any bruise. Okay, so there were no bruise noted there. So then I'm going to get you to turn around for me, or turn to the side rather. So I'm inspecting the posterior chest, and the posterior chest is equal, symmetrical. Upon expansion, there's not any nasal flaring. So then I'm going to go ahead and palpate the posterior chest. So we're going to test for egophony. So I want you to say E with each touch.
E, 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 E.
Okay, so egophony is negative. So then we're going to go ahead and test for bronchoscopy. So I want you to say 99 with each touch.
99, 99, 99, 99, 99.
Okay, so egophony is negative as well. So then we're going to go ahead and percuss. Okay, so no tympani was present there. And then I'm going to go ahead and auscultate. The breath sounds were clear upon auscultation. So then I'm going to have you just turn back around for me and face me, actually, because I want the camera to see you, just see all of our movements for the full assessment. So inspecting the anterior chest. The anterior chest is equal. Chest rise is normal equal upon expansion. So then I'm going to go ahead and just palpate the chest area. Okay, the chest is equal. And then chest wall is equal and symmetrical. So then I'm going to go ahead and listen. To each long fill. Okay. The anterior chest wall is clear upon auscultation as well. So then I will go ahead and just test once again for any firmity. So say 99 with each touch.
99, 99, 99, 99, 99, 99.
Okay, so no firmities was noted in the anterior chest wall. So then I'm going to go ahead and move along to assess the heart sounds. So I will take starting with the diaphragm of my stethoscope, and I will start with the aortic, which is the second intercostal space on the right second intercostal space. And then I would test the pulmonic valve, which is the left second intercostal space. And then I would test Erb's point, which is the left third intercostal space. And then I would move along to the tricuspid, which is the third intercostal space on the left. And then the mitral valve, which is the fifth intercostal space, which is the fifth on the left side, fifth intercostal space on the left side. All right, and this is also the point of maximal impulse. So then I would also test with the bell of my stethoscope, testing the pulmonic, the aortic first, which is on the right, then pulmonic, then Erb's point, tricuspid, and then the mitral valve. Okay, and then also this is also where the apical pulse is located. So I'm going to listen for 60 seconds. Okay, and the apical pulse is 70. All right, so now we're at the point where I need you to lie down for me. All right, so I'm going to have you sit up for about 30 degrees. About right there. So turn your head to the left for me. And we're just testing for any JVD distension. All right, and then turn to the right for me. All right, so no JVD distension was noted. So then could you lie back for me? So lying back, once again, I will test the anterior chest wall. Everything is equal upon expansion. Just a moment, I'm going to bring my camera just a little bit closer here. Okay, so like I said, the chest line is equal and even upon expansion. So then we're gonna go ahead and auscultate one more time. Started with the aortic, then pulmonic, Erb's point, tricuspid, and then the mitral valve. All right, there were no groups present. S1 and S2 were present. No gallops, no murmurs were present. So then we move on to the abdomen. So upon inspection, the abdomen is flat. There are no curvatures or contours. So then I would begin listening to the vowel sounds, starting with the right upper quadrant, and then the right lower quadrant, the left upper quadrant, left lower quadrant. All right, so vowel sounds are normative and active in all four quadrants. So then we would move ahead with the abdominal assessment and move on to, we would also listen to the aortic artery. So renal arteries and the femoral arteries. Okay, and there were no groups noted in the abdomen arteries. So then we would move along to percussion, and we would percuss the abdomen in all four quadrants. Okay, so no resonance noted. Then we would palpate the abdomen. All right, does that hurt?
No.
Okay, so there was no tenderness noted upon palpation for the abdomen. So now we would also palpate for the liver and spleen. Okay, the liver or the spleen were non-palpable. Both were non-palpable. So then we would move ahead and we would have the patient to sit up again. So let me get my stool. So, wait, I need to come out a little bit more, don't I? All right, so we are moving ahead to the musculoskeletal system. All right, so the musculoskeletal system. First, you can't see me. First we would start with. So I'm gonna get you to turn to the side here. We need to test for CVA tenderness. All right, is that tender at all?
No.
Okay. All right, so I'll get you to turn back here for me. So for the musculoskeletal system, we would start with inspecting the patient's hands and wrists, fingers. This is for the upper extremities. So we don't see any nodules present, no lesions. So then we will go ahead and test for range of motion in the fingers. So I would get you to just touch your thumb with each finger. So good. So also just follow whatever movements I make. I want you to follow as well. So we would do flexion. So for flexion, first I want you to do flexion, then extension. So, and then I want you to do hyperflexion. So, and then I want you to just continue to follow me. We'll do abduction and then adduction. Good. So range of motion and thumb opposition is what we did at the beginning. Range of motion is intact in the fingers. So then we would do the wrist. So we would start with, we would first begin with flexion. So flexion for the wrist and then extension. So then we would do hyper extension and then internal rotation and then external rotation. So, and then we would test the strength of each hand by having you grab my hands. All right, squeeze it hard. Good. So strength is 5 out of 5 and equal on both sides. So then we will move on and test the strength of the biceps and triceps. So can I get you to hold your arms up like this and then try to push my hands, then push them back. Good. So range of motion and strength is 5 out of 5 and it's biceps and triceps. So then we would move ahead and test the strength of your shoulders. So can I get you to shrug your shoulders? All right, and then can I get you to adduct your shoulders? So I'm going to push down and you try to push up. Okay, that's good. Strength is 5 out of 5 in the shoulders. So then we would also, this was cranial nerve number 8, which is the accessory nerve, and it is intact, which we have seen by the patient doing the shoulder movement, shrugging the shoulder movement. So then we would move ahead, and the next thing we would do is the hand to flip movements. So, all right, that's good. And then we would do finger to thumb opposition. Okay, that's good. So finger opposition is intact, and hand to flip movements are intact. So then we would assess for stereogenesis. So I'm going to place an object in your hand. I want you to close your eyes. All right, what is that object?
A key.
Okay, good. It is a key, so stereogenesis is intact. So then we would move ahead and do the gravesthesia, which is the, I'm going to get you to close your eyes again. So hold out your hand for me. So I'm going to draw something in your hand. You just tell me what it is.
A T.
Okay, and then hold out your right hand. I'm going to draw something. Tell me what it is.
A W.
Yes, that's correct. So gravidesia is present. So then we're just moving on, and we're going to do the deep tendon reflexes. So starting with the biceps. So I'm going to test your bicep reflexes. So hold your arm up for me. Okay, so bicep reflexes are intact. Then we're going to test the patellar reflexes. So just hold out your leg for me. Okay. Okay. So patellar reflexes are intact. So then we're going to move on to the Babinski and the Achilles. Okay. So okay, and then the Achilles. Okay. I really need you to take your other sock off there if you don't mind, ma'am. All right, so then we will, this actually would have us to move on and have you stand up at this point. All right, could you hop on one foot for me? All right, and then hop on the other foot, left foot. All right, good. So, and then we will also test your strength of your hips. So, could you do extension? And then raise your knee. And then we would do the abduction. And then the inversion. Inversion and then exversion. Okay, so then this would actually conclude our exam. So thank you for your time and have a good evening.